Good afternoon. We had a good weekend. Unfortunately, moving forward, at least for the immediate future, we'll update hospital data on Mondays. It's more consistent. It's easier as different groups from our health department to the hospitals have earned to get some time off on weekends again. So, but being that over the last 3 days, we lost two members of the community. Male in his 70s, and another male in his 60s. So certainly want to think about them and their families. We've now lost 690 county residents to COVID-19 specifically. So it's obviously very sad. Our 7-day rolling average is 0.9. On cases over the weekend, we reported 90 cases one day, 95 another day. We cleaned up the cases. What does that mean? That means on Mondays we transfer out some of the cases, or we get the transferred out numbers. So it was actually 22 less cases over the weekend than we reported. So 90 plus 95 is 185 minus 22 is what we actually had. So the 7-day rolling average 0.9. We're staying under that 1% number, which is really really good. We have 45 new cases today. So that's better line. Not as many tests though. When we have higher case days, we're having really large test days as well. As you can see, our positive rate doesn't really move when you have a 90 or a 45 case day because it's really a reflection of testing. And so active cases right now, we have 417. Same picture. At minimum, we have 70% of our cases every day. That 49 and under range. We've had it as high as 90%. So certainly we appreciate the news today from the state, catching up with where we need to be. Hospitalizations, 32 members of the community are in the hospital, and 7 members of the community are in the ICU. So please keep them in your thoughts and prayers as we need them to get better, get well. On the vaccine front, the state moved kind of where we were. So tomorrow, those who are between the ages of 30 and above are eligible. So if you're on our wait list, you can now just go get an appointment. We have, I believe, appointments for tomorrow. I think there's close to another 500 available right now. Wednesday, look out for Wednesday. How our system allows us is we'll have about 1,400 available, and then we're going to add on to those. So as soon as we get to the 1,400 slots, we'll add another 900 or so appointments for Wednesday as well. So please get vaccinated. For those who are in the 30 to 40 demographics specifically, it's your turn to get vaccinated and do the right thing. A little more social group. You've been out there, a little more COVID active cases in this demographic, so we need you to get vaccinated so we can, as a community, get back to business and get our lives back. The following week, 16 and above are going to be eligible. A reminder to parents, the Pfizer vaccine, 16 and above, anybody 16, 17, or 18. The Moderna and Johnson & Johnson vaccine is 18 and above. So we're going to reach out to high schools and start to work with high schools specifically with that. But the Pfizer vaccine is the only vaccine you can get if you're a 16 or 17-year-old at this point. And so certainly we want to, again, if you look at any K through 12 cases, predominantly your 16 and 17-year-olds. So certainly we will be vaccinating in those demographics just like we will with college kids as well, so we can really attack where these cases are generating. But overall, we're happy. We've been asking the state to loosen up the guidance on eligibility. They have, so we're happy about that. Reminder, symptomatic testing, really we need people who are symptomatic to rule out COVID now. A lot of people start getting sniffles and allergies this time of year. Those are, you know, symptoms of COVID. We saw this play out last year. Please get your testing done on gov.net/Cayuga Medical. That's where we have our partners with Cayuga Medical at the FSHAD Monday through Friday, 9 to 1. Asymptomatic testing, you can go to covid19.ongov.net and look at appointments. We have on-center appointments here, and then we have appointments where we're in the community still testing. For example, today we're at East Syracuse Village Hall, the Fayetteville Village Hall, and the Cicero American Legion. Tomorrow we will be at the Northeast Community Center and the Lafayette Community Center. Wednesday at the Skinny Atlas district offices. Thursday, Onondaga Town Hall in Shove Park, and Friday we will be at the Town of Clay Senior Center. Specifically, if you have family members who are away on spring break this week, really a good idea to test when you come back. Even if you've been vaccinated, you might want to consider that. Obviously, the idea for testing is that we find the virus, we find the cases. We don't get angry when we see cases. We try to box in the virus and end that strain there. So that's testing. Vaccinations, again, I think going into today, we had about 162,000 residents vaccinated in the county. It's about 44% of our adults. I think 35% of the population. That number will probably will go over 170 this week, maybe even to 175 by the end of the week. So it's exciting. We're getting through these demographics. We got to get everybody who's willing to get the shot, and then we need to really hunker down into the communities or the geographic regions of folks who may have some hesitancy, and try to do our job to get those folks comfortable with getting the shot, and then get to the numbers we need to get to develop the herd immunity. So that's that. I'll go through on Wednesday night, I'm doing the State of the County address, and certainly we encourage people to tune into that. We'll talk about, obviously, what we've all lived through over the last 13 months, but also what the next step is in this process. And we'll roll out our recovery plan for the county, and then we're going to get to business. So saying that, happy to take questions.
Ryan, when the eligibility drops down to 16, does the county have any plans to go out to the schools and places like SU to vaccinate young people right on site, or is the idea to just keep bringing them in here and to the fairgrounds?
So we know that the university's been talking to the State Department of Health related to being a vaccination site. What we'll look at, Jim, is, again, my anticipation is we got our allotment this week, right? It's about the same that we got last week. And remember, vaccine week is Wednesday to Wednesday, so we're still technically today and tomorrow using vaccine that we received last week. But we get our new vaccine, and so which is good. I think overall we'll get through a lot of this 40-year-old to 50-year-old demographic. We'll get through some of the the 30-year-old as well. But I expect there to be more vaccine in next week's allotment. And so I think what you'll see is, one, your pharmacies and your doctor's offices have all started to get more vaccine now. And I think this week we probably had a dozen or so doctor's offices get direct allotments. And so they'll be able to vaccinate too as well. But yeah, so we want to see what Syracuse University gets. We want to see talk to Lemoyne about who we can vaccinate there, ESF. And then we'll see where the cases are still going. And certainly we'll probably micro-target vaccine to where we see cases. We then will work with high schools, most likely, to talk to parents, look at pre-registration systems within their own student bodies. And then, yeah, we want to go. It's probably easier for us to go to a pop-up clinic at a high school than to get them all here. So we'll look at all of that. and it's good. We're in a good spot to be doing this in April, and I'm excited. Hopefully, we'll get through all the willing members of the community, the adult population, in April, and then we can really micro target in May on the hesitancy, and we'll continue to do pop-up clinics as well. I think we have a couple of them this week.
Would you speak more to the idea of bringing them to high schools? It doesn't sound like that's something you're planning as soon as next week. So how do you prioritize this broad category now to make sure you do it in kind of a need it most kind of basis?
Yeah, so part of whatever we get will just be open to the public, just like it always has been. But we will be surgical. So say Syracuse University gets, I don't know, 1,000 doses of vaccine, but we know we can get a dorm done that has had outbreak in that facility, a congregate facility with another 1,000 doses. We probably partner up there, right? And so, and they have infrastructure with their nurses on staff, and their nurses helped us in the beginning. So we'll look at things like that, Andrew. We'll probably, we won't be ready right away to do any pop-ups with the high schools because they're on break this week anyways. So communicating and the level of detail and planning, we probably won't be ready to do yet, but we'll probably look at the next week to start to do some of that. And again, we're going to look at the data. We know that there's cases with high school kids, and we know that as the year goes on, there's bigger risk in those groups as they start to gather more and do more things as their high school careers start to end. So we understand that. It's about being practical with this virus right now. And so these are all our partners that we've worked with so much throughout this. Now we'll be working with them to get their students vaccinated.
I remember talking with Ann Rooney and seeing the whiteboard when you had the very complex testing schedule. Can you use a similar infrastructure to kind of repeat that with schools, but with a vaccine focus?
You can, and we have the mobile teams that you can do that. Again, a lot of it depends on your second shot days here at the on-center. A lot of people say, what about the drive-through again at Shoppingtown? We'll do that again, but you can't do the amount of infrastructure to set up a site. It really doesn't, at some point, you have diminishing returns, right? So it takes a lot to vaccinate 100 people with just simple infrastructure. So you want to try to make that at least 500 people when you can for pop-ups. You can't spread yourself too thin when you have second shots. So when we have big second shot days, we'll always do clinics at the on-center. When we have the ability to, our second shot days aren't that large, and when you get the J&J shot, you can more flexibility because that's only one shot. You don't got to plan for a second shot. So there's a lot of logistics and planning that goes into this overall. But we'll be out in the community more, especially when we get to that point where we feel that everybody who really is eager to get a shot has gotten a shot. And then you got people who are on the fence. And you got some people who have a mindset, well, geez, people my age, when they get this, we don't get that sick. And they aren't loosening up the regulations. I won't be able to do what I want to do anyways, so I'm not going to get the shot. Those are people we can have a conversation with and let them understand. The way we get these regulations loosened up is we need everybody to get the shot. Some people just won't, and we understand that. But we do got to get to that 75, 80% participation with the community.
Could it present a challenge if the allotment stays the same as this week as it does for next week and with expanded eligibility?
Yeah, it will, but it won't. What it will be more is we probably won't be able to do as much outside of our own infrastructure that we would have liked to. But I would think that we've always heard that in April the Johnson & Johnson's second wave of supply will be manufactured. So again, I'm assuming something right now. We know what happens when you assume, right? We can spell that out. But I'm going to assume that we're going to get more vaccine next week, and we'll be able to do more with that J&J shot. That J&J shot's a great shot for high school students as well, right? College students.
Are you getting to a point where you're going to add a permanent second pot, or is that kind of out the window with these plans?
Yeah. It depends, right? So one of the things that has been nice is the fairground site really has, you've had really two pretty large mass vaccination sites, and it's churning through eligibility, right? So I don't know if we'll have a permanent second location, but try to be more mobile in the community to really go and meet the demand. We will do more drive-through days when when the weather permits and when we have easy second dose clinics that week, because people really did enjoy the drive-through clinic.
What's the this week's allotment in numbers?
It's about 6,000. So we had about 6,000. Sometimes sometimes what happens too, Andrew, is during the week other partners. I think last week one of the pharmacies had a lot of supply left, and that came to us to get out. And sometimes you'll get talking to the state during the week saying, "Can you take an extra tray of this?" And we do. And again, if someone said, "Hey, will you take an extra tray?" We'll say, "Yeah, we'll take that." We expect next week to have more, because we can do more.
That's a first shot allotment.
Yep.
Is SU guaranteed to get its own?
There's no guarantees, but they've been talking to the state. It would make perfect sense. They have nurses. They are right there. They can go into a dorm right there, bring the kids through. So that would make a lot of sense.
Do college kids take priority over high schoolers because of their living situation?
I think they do. With the congregate settings, I think they do, yeah.
Can you give the J&J shot to 16-year-olds, or is 18 the youngest?
18, yeah.
Do we know which school districts have received the barriers, which have not yet?
I don't have that answer for you, but we can get that for you.
Back to the age requirements, I think you bring up a good point that only the Pfizer brand is for the 16 and 17-year-olds. How do you change your registration system, your operation, to ensure that when someone goes online looking for a shot, a mom or a dad on behalf of their teenager, 16, 17 specifically, that they're definitely getting the Pfizer? So
right now, the best way, and again, for the last 2 weeks, now we did receive some Moderna last week, but this week we only have Pfizer with some Johnson & Johnson, and our Johnson & Johnson allocation will be to finish up our homebound senior population, potentially finish up some other hard-to-reach populations. So right now, to the public at large, what we have is Pfizer. And so again, next week, because we have the infrastructure to handle the Pfizer vaccine, what you're seeing is the Moderna vaccine will go to the doctors' offices, and then eventually some J&J potentially as well. And we'll probably be the Pfizer carrier here with the fairgrounds, probably with some J&J. And then you'll probably see these other points of distribution carrying the Moderna.
So go to the county site for 16 and 17.
Yeah, I think, and again, we'll partner with the districts. I think this is probably going to be a space that we're going to be pretty active in.
On a completely different topic, I have a few questions about Skyline. How long has the county been making those annual payments of approximately $150,000? And how long has the county known about the conditions there?
Well, we were brought in to inspect. We don't have a codes department, right? So we were brought in February. The city reached out to us with concerns about health and safety concerns. Our health department went. They were cited. We went back the Monday before, I believe, the victim was found, and there was progress, but it was not cleaned up. And then I believe there's a hearing scheduled related to that. We do not levy code decisions, right? So that's done at the local level. So that's a town or a village or a city. We can stop housing assistance to locations once certain decisions have been levied. The day that the mayor spoke about the decision that the city made, the mayor called me, gave me a heads up, and within moments, we froze all payments to this account. How long has it been going? Most of the payments to this facility actually go to partners, right? They don't go directly to the tenant, then to the management company. They go to some of our nonprofit partners who are responsible for housing their clients. So that's the majority of the payments. But I would have to look at what the history is. I'm assuming, I don't know how long these partners have been paying it. And again, certain individuals in the community qualify for assistance. That flows, right? They can move to the Skyline and then move somewhere else, and that money would flow with the client. But those are all things that you could work with our team on to get those answers.
But you've known about the conditions for a few years now. It's just when the county is
No,
able
and
to
quite
kind
frankly, we are not in the housing business, right? So if you look at where we are, did I, you know, with all things, you sometimes read things. But were we alerted to any specific conditions? No, we were in February.
I'm with Citrus TV News. Do you support the Syracuse University vaccine requirement for the fall semester?
I think it's smart, but I think people have it's right. If you don't want to get a vaccine, that's your call, right? I think it's probably not the right call, but forcing shots on somebody isn't something I'm comfortable with.
Do you see the university as a county vaccination site, say, over the summer or anytime soon?
I do. I think they will have. I think they'll be licensed with the state in short order to be a vaccination site. And I think what may happen is we either provide more personnel to help them and potentially redirect more vaccine, or we just bring our vaccine with us and do more. But if you look at where I think we are now, and a lot of epidemiologists agree with what we've been talking about for the last 2 weeks, is that we vaccinated our most vulnerable first, our seniors, and then those who have comorbidities. And if you look at the 690 people we've lost in this pandemic, every single one of them fell into one of those categories. Either they had comorbidities or they were a senior. We've gotten through that. And so now what we need to do, and eligibility is just opening up, so it makes it easier. But where we were stuck in neutral for a couple weeks here. What we really need to do now is focus in on where the risk to the community at large is. And the risk is essentially within the populations or the demographics that gather more or come from more places. And so the universities need to be vaccinated. I've had some suggest that why do we still have them in school? We still have them in school because that's who we are. We're a community that is an eds and meds economy, and of course we're not going to send the kids home. We can walk and chew gum in this community, and we will, and we'll vaccinate these kids and get through this.
For a while, you'd list the different age ranges and the number of cases per age range.
Yep.
Do you know, is 20 to 30 or 30 to 40 the highest number of active cases currently?
Oh, without question. So you have really what you see right now today, the 16 to 19, which would represent your congregate settings, right? That's the highest today, but without question, that 16 to 30 bracket is then that 30 to 40 then comes in. Your vaccinated brackets at this point are just 1 or 2 cases a day.
Do you have the list in front of you?
I have today's, yeah.
Okay. Would you read those youngest or show me later?
Well, you have 16 and 19 had 9 out of the 45 cases. 20 to 29 had 6, and then 30 to 39 had 8, 40 to 49 had 4, 50 to 59 had 8. That's kind of a higher number for that demographic recently. And then you had 2 60 to 69, 1 70 to 79, 2 80 to 89, and 1 90 and above.
The governor said that people 30 plus can sign up starting tomorrow at 8 o'clock. I know the county's website still blocks people with a certain age as of this moment.
I think we fixed that, didn't we? I thought we fixed that.
So people can sign up tonight,
Yes.
and you encourage
Yes.
them to.
I want them to. Yeah, the micromanaging of those level of details is unnecessary. So we pulled from our list. We pulled people last week. It doesn't think about it this way. So if we are paying 50 people to vaccinate, and based off of the eligibility requirements from a macro, not a micro level, you only have 200 or 300 people signing up, but you're supposed to do 1,200 vaccines. It's a waste of money, let alone, you get behind your schedule of vaccinating because there's only so many doses you can actually vaccinate in a day. You have to keep on this pace, keep on that schedule. So when we have those challenges, we hit our 40 to 49 waiting list, and I don't know if we got down to the 30 to 40 waiting list, but we vaccinated people last week that were 40 to 50.
But the news in this is you're not waiting till 8 in the morning like the state is.
No.
You're able to sign up
Correct.
for tonight.
Please do.
Do you expect any kind of logjam again that this eligibility is wide open?
I don't think so. I think in the beginning you had really demographics of almost 90,000 people at one point, and there was only so many appointments now. Now you have, I didn't see the total number. I didn't add them all up, but outside of the fairgrounds site, which gets its own, large supply, I think you have probably 20,000 first shots this week, right? And so that's a good chunk. And again, a lot of folks who have already qualified for an existing condition, a lot of folks in these demographics already have gotten the shot as well. So I think we'll get through it quicker than people think. And then once you get to the 16, 17, 18-year-olds, it's going to be a lot of kids, right? It's going to be a lot of people. Then you're going to get through your 20s. It's going to be a lot of people who probably don't have the pre-existing conditions at the same rate that the groups of 40-year-olds do.
Do you have a percentage of the county's vaccination currently?
So it's it's over 35 going into today for the whole county. It was over 44% of adults going into today. And again, I look more at the adult number because that's the only people that can get the shot right now. So we're doing well. If you factor in, remember, when you look at herd immunity, you're looking at who you vaccinate, and then there's everybody who's gotten it too. And so we've reported out over 33,000 cases. We know there's more than that, right? So what is it? Was there another 30,000 that went undetected at some point? What's the immunity level of what kind of immunity those people still have? So really the numbers are much better when you look at the natural immunity in the community plus the vaccination immunity.
A few more questions on Skyline. Are you trying to learn what other facilities in the community are kind of deemed unfit to live in, especially those that may be receiving county support?
We need, we expect communication from any municipality that has code issues like that, yeah. Again, we don't have the people, that's not our job to determine housing conditions. We've asked for, and we will be asking the state to change some of their laws that give us more flexibility where we don't have to wait for some of these decisions to be levied. And we'll talk about that further once we have that ready for our state partners, hopefully to address. But I think our main housing partner is the city of Syracuse. And certainly I know the mayor, if he feels that there's another property that is in a similar situation, will let us know immediately.
Do you have confidence that these problems can actually get fixed? I mean, just this morning there was a stabbing outside of Skyline Apartments.
Yeah, so those are different problems, right? So clearly we don't have faith in the ownership. I think the Common Council might have passed today some security, which will hopefully help. But that's a different problem, right? We can't cite that problem. The problems that we cite are fixable, and the management needs to fix them. It's about investing money in taking pride in the facility itself, so your residents have pride, and some of these things don't happen then. But the public safety piece is something that is a different topic altogether with what's going on. But certainly we fully believe that the management can fix these health violations that we've put into place, and they should be fixing them immediately.
Have you spoken with Troy Green or the Green family at all?
I have not spoken to them. I think they called our office, but I haven't spoken to them directly. I saw a little bit of it. Then the main event at 3 o'clock was about to start, so I had to come over here. These look at it's frustrating to see these allegations continuing to happen. I think that process is underway. At the same time, that's stuff that's out of our control here at the local level. The state needs to handle what's going on there, and the Attorney General, and I think they are. But my concerns are still here that what we're doing here in response to the pandemic can't be impacted by everything going on in Albany. And at least today we saw a little bit of movement in the right direction related to vaccine and eligibility. But certainly I have voiced my disapproval with some of the control out of Albany over local decisions because, quite frankly, I don't think they're at the top of anybody's attention in Albany right now. But they matter a lot to local businesses here and our community here.
There's some recent data and polls that suggest younger people are now more hesitant again to get the vaccine, or they don't want it for a variety of reasons. What can the county do, especially with the age lowering soon, to encourage younger people to get the vaccine?
Yeah, so I think you got to find out, and again, it's tough, right? So there's some data now; it's not conclusive, right? But we're starting to see some trends, right? There's some trends that, based off of communities that have historically been disenfranchised. We know that. We've been talking about that. We're starting to see some of the things with young people. We're starting to see some potential political ideology with people with certain beliefs. You know, we don't know it, but it's starting to look like that a little bit. So I think one of the things that, in order to really figure it out and then put resources towards it, you have to confirm it's a problem. And the only way you can do that is you need to vaccinate all the willing. So I think really before we can really get into the micro-targeting, we need 3 or 4 weeks of getting everybody who wants the shot, because then you can look at the data and you look and really micro-target the data, and then you can see where it is. Then you start your campaigns and your dialogues. Look, if I'm a young person right now, you've had a lot to go through over the last year, a lot of things that really are, these are prime years for exploration and other things. The best way to get that back is to get this shot. That's the bottom line. And so I think some of the frustration out there is people, the things they don't like about the pandemic are supposed to end when you get the vaccine, and some of the messaging from leaders isn't suggesting that. So I think the messaging from our federal and state governments needs to be a little bit stronger. The vaccine's good. It works. Once we get enough people to get the vaccine, we're going to be in a different spot with this pandemic, and the things we value as a community we'll be able to do again. I think we just got to message that a little bit clearer, because then those people on the fence will get it done.
We've asked the state for a reasoning or data to show why restaurants and bars still have that curfew in effect. We haven't received an answer. Have you asked the state to give you a reasoning as to why this curfew isn't going to be lifted like the other venues and fitness and gyms and stuff like that?
Yeah, I think it's just an arbitrary decision right now, right? Because there's not data. It's to suggest that COVID is stronger at 11:05 than 10:55, right? It just doesn't exist. So it's the when we had data going into the second wave, I personally supported a curfew. There is no data to suggest now that this is happening in restaurants at higher rates of transmission than anywhere else. It's actually probably the other way around. I would still make the argument that the social gatherings and living room spread, there's more cases of that now. So it's an arbitrary call right now by the state, and again, one that should be made at the local level based off of local transmission rates. I understand in New York City when there's a 5% positive rate and you have all those people there having harder regulations. I understand that, and I think that I would probably make those decisions too if I was the mayor of New York City. I'm not. In our county, our transmission rates, even after I I think we had a couple bumps in the road with some high case days compared to where we were. We're still under 1%. And even after we know there's a lot of gatherings over the last week, right, with different sporting venues. So I just, this is the perfect regulation that should be made at the local level. The state of New York, we don't need anyone from Albany telling us what time restaurants and bars should be open. We just don't. Yeah, it's kind of tough. They had a great run and they good year. Those kids overall, think about the kind of isolation the athletes went through, right? So if they had to almost quarantine from each other in ways and eat alone and do all these things, because if you get one case in that group, that could lead to various quarantines. So it's amazing what all these teams have gone through, and then it was nice to see our guys go through a hard regular season and have a nice run. You wish the basketball gods were a little bit kinder with some of the shooting, because our defense was strong enough to win that game. So, but you got a lot of pieces coming back next year. So something to look forward to, and I'm very grateful that they went on the run they did for the mental health of the community.
Do you have a pick moving forward? Anyone you're interested in?
Well, I think Gonzaga is just gonna. I mean, they're arguably one of the best teams we've seen in a long time. So I think they were my pick in the beginning. But after watching them play Creighton yesterday, I think they're going to do just fine. Anything else? All right. Thanks, everybody. We'll see you on Thursday.